Hello, I'm Scott Hollington, Dr. Scott Hollington. Today I'm going to talk about buprenorphine, suboxone, and subutex. Specifically today we're going to discuss the differences between buprenorphine preparations that have naloxone in them and buprenorphines that do not have naloxone. There are many formulations of buprenorphine, suboxone, which I believe is still made, subutex, which is not really made anymore, hasn't been for over a decade, but is the name that we generically refer to preparations of buprenorphine without naloxone. There's others that have various bioavailabilities, and one of these is Zubsolv. There are many others. Like any generic med, there are differences in qualities between the generic versions of buprenorphine with or without naloxone, and the name medications are perhaps better, certainly more consistent. But the real interesting thing about the different preparations of suboxone is mainly that whether they contain naloxone or not. Now, naloxone is an opiate blocker with no opiate effect. So if you are intoxicated or overdosed on opiates, naloxone can be given. It will block the opiates and it will bring you back to a sobriety. We call this precipitated withdrawal, and it can be most unpleasant. So normally withdrawal, you go slowly from, having a high degree of pain relief to having no pain relief. But precipitated withdrawal is pain relief to nothing just immediately. And I believe that most people who have gone through this experience pretty extreme withdrawal effects. It's pretty unpleasant. Okay. So why would we put an opiate blocker in with buprenorphine, which is supposed to be an opiate, basically partial agonist opiate? Well, buprenorphine by itself is a partial agonist, partial antagonist, so it also blocks other opiates. And people think that if you put naloxone in there, it blocks more, and the answer is, in theory, it does not. The naloxone is put in there not because it's functional. The naloxone is put into the mix because the naloxone is intended to keep people from misusing the buprenorphine. The DEA seems to feel that people inject and are able to misuse the buprenorphine by injecting it. Now, whether that's a legitimate claim or not, and it appears to not be, I think that it's very rare that people do inject. People do inject buprenorphine, they do. But it's rare because heroin is much stronger and gives you a much better high, and why would you inject buprenorphine, which is more expensive and a lesser high, if you could get heroin and do that? So anyway, I think that the argument is not a very good one, but anything to try to help people to experience less addiction. So the naloxone, when you put the buprenorphine with naloxone under your tongue, in theory, the naloxone is destroyed because it is not absorbed and it goes to your stomach and is destroyed there. The buprenorphine, on the other hand, is absorbed under the tongue and gives you the buprenorphine effect. So again, in theory, the buprenorphine with naloxone versus the buprenorphine without naloxone is the same. Now, everyone knows that some people have a reaction to the naloxone. And the DEA will tell you with a straight face that the reaction to the naloxone is only 1 in 1,000 patients. Not true. Definitely not true. Certainly that number is more than 1 in 1,000, whether it's 1 in 100 or 1 in 50 or 1 in 3, is not really known. That research needs to be done. It has not been done. And as a physician, prescribing a medication that has not been experimentally shown how it functions is a problem. So if you're a physician and you're thinking about whether you should prescribe suboxone or subutex, and you know that the difference is the naloxone, and the naloxone has not been characterized as to whether it is harmful to patients or not, that is a problem. That's a problem for the prescribing physician. It is not a problem for the DEA. They don't really care whether people have a reaction to the naloxone or not. They feel that the naloxone adds a degree of safety to the medication that justifies whatever side effects it may have. It is true that if you can take suboxone, that's with naloxone, then that is the medication that you should take. I don't think that that's in dispute. The fact is if you can take suboxone with the naloxone, it does offer a degree of safety, not only to the patient who's taking it, but also to has less street value, so nobody's going to steal it. If it falls into the hands of somebody who is a unscrupulous person, it's much less likely to be abused. So it definitely is a better deal if it doesn't give you any reaction. Unfortunately, there are many reactions people report from naloxone. I personally have seen gross, massive swelling of the legs, rashes, obviously. People report blinding headaches and nausea and vomiting and even mild seizure behaviors from the naloxone. And if you have that reaction to the naloxone, I think it's reasonable to not want to take that, obviously. All right. That's really what I wanted to talk about today, was the difference between buprenorphine with and without naloxone. If you can take the buprenorphine with naloxone, you should take that. If you cannot tolerate the naloxone, then subutex, which is the common name we use for things without naloxone, is, in my opinion, an acceptable alternative, although it can be harder to get through the pharmacies because of the public distrust of people who use that medication.